You will need to get the health workers on board, no? Paano pag sinabi nila, bakit na naman kami pipigilan to look for greener pastures abroad?
Hindi naman
Anong isasagot nyo kapag gano'n?
Yeah, hindi naman po sa pipigilan. Actually, we always would say that that would be always be the right of our healthcare workers. That would be their right if they want to go abroad for greener pastures. Pero kailangan mapag-usapan pa rin within or between and among countries how this recruitment should be done as ethically as possible. Kasi yung iba talaga, they set up nursing schools already here in our country. We have identified 2 nursing schools that are owned by other countries and are producing for them already and not for our country. So this kind of agreement should be done and should be discussed in the global picture. Hindi na lang po dito talaga because it's really affecting us. But nevertheless, we already have identified strategies and we have presented to the President already I think that was about a month ago, where the President already instructed CHED to start working with universities. At kanina po, nag-attend ako ng International Nurses Forum, and I discussed with the Dean of the UP College of Nursing as well as the other deans there, na sila po ay makikipagtulungan sa atin with the Department of Health on setting up strategies on how we can better retain and also be able to ensure that there is reintegration of our nurses coming from abroad, going back to the country. Here in the Philippines, our strategies, we've laid it out. We are trying to consult a certain specific professional groups already. Unang-una, ang gusto natin makita that there would be bilateral agreements. Like if our nurses will be recruited in other countries, the country which is recruiting our nurses should give us something in return. Like, for example, for every 10 nurses that they get, there should be 10 individuals that they would send off for scholarship so that we can also replace here. So we need to have this kind of agreements with this country so that hindi naman tayo laging nasa losing end, and we can also be able to retain our individuals or nurses here in the country.
Is that a Philippine initiative or a global initiative?
This is something that is being thought of and discussed among us in the Department of Health of the Philippines. In other countries, I have not heard of this kind of agreements yet, although in that international meeting, there was this strong position among the smaller income countries nga, that it should be discussed already at that international globe or globally, that there should be this kind of ethical recruitment and that there should be some form of regulation so that we can be able to avoid itong drain of healthcare workers among lower income countries.
Ma'am, that's an interesting concept, ethical recruitment. How could that be? I don't know. I don't know if you have an answer to this already. But how could that be conceptualized and enforced? Treaties or multilateral agreements?
Yes, actually, there is this avenue where we can discuss that, and that would be during World Health Assemblies, which is hosted by the World Health Organization. So during these assemblies, we discuss this kind of health matters where we can put that as part of the agenda. We just need to position and, of course, have our embassy help us, the Department of Foreign Affairs, through also our WHO country offices. So I think this would be part of the agenda because it is not just our country which is experiencing this. A lot of countries are experiencing, even the high-income countries are experiencing their shortage. That's why they're getting our nurses and other healthcare workers from the different countries across.